My name is Rachel Rucker. I am a family medicine physician here at Jefferson City Medical Group. I originally grew up near Cape Girardeau, Missouri. I went to medical school in Kansas City where I met my husband. He was in pharmacy school and I was in medical school. Then I went to my residency training in Kirksville, Missouri. I became a doctor because I grew up in the medical field. My mom was a OB nurse. She's now retired, but I would often visit her while she was at work, and it was just something that I feel like I could do. The reason why I specifically chose family medicine is I love the fact that we do just a little bit of everything. I like procedures, I like conversations, I like getting to know people, meeting people, and so I feel like I can do just a little bit of everything. The one thing I love about Jefferson City Medical Group is I love how we approach patient care as a group. I have no issues going and speaking with a specialist if it's on behalf of a patient, so that way as a team we can form the best type of patient care. It is important to have a primary care doctor because we know you when you're at your baseline, when you're at your normal. So that way, should anything come up and something's different, I feel like gives us an extra benefit of providing more adequate care. One piece of advice that I give to my patients, and I give them often, is just to take a little bit of time for yourself every day, whether it's 30 minutes, 15 minutes, just to set aside time just to relax, regroup, so that way you can be the best you can be. In addition to the medical care I like to provide for patients, I also like to incorporate my knowledge in different aspects of their life as well. I am a very big fitness buff. I have a very athletic background, and so that often will coincide with my patient care. I love to talk about exercise. I like to talk about nutrition. I like to talk about sleep habits. So it's just another aspect, another layer of care that I like to provide my patients.